3, 2, 1, go. Welcome to the Mack Talks, everybody. I am your host, Scott Johnson. This young fella on my right side is your co-host, Chase Hutchison.
Hi, guys.
Chase, tell the people what the Mack Talks are.
So if you're a business owner, entrepreneur, or impactful leader, the Mack Talks are the vehicle that brings you the stories that you need to hear.
That's right. That's what we do here. Today we have a great guest, and in a second, young Chaseford is going to go ahead and introduce her. She is a client of our digital marketing agency, Mack Media. She is somebody that we have a lot of respect for and we really like talking to. So Chase, why don't you go ahead and introduce our guests?
Yeah, so our next, and this is a bit long-winded, our next guest on the Mack Talks is a Connecticut certified school psychologist, a licensed professional counselor, and a board-certified neurofeedback provider. She has more than 20 years of experience working with children, teens, adults, and parents. She currently owns a private practice in Richfield in Newtown, Connecticut, where her focus is on neurofeedback, counseling, and assessment of a variety of health issues and conditions. Dr. Roseann utilizes highly effective, research-based, holistic, non-medication, and brain-based therapies to alleviate stress and suffering, bringing children and adults to a point of wellness. She serves on the board of the Northeast Regional Biofeedback Society, Epidemic Answers, and is a task force advisor to Lyme Connection Foundation. She is also the co-author of her new book, Brain Under Attack, a resource for parents and caregivers of children with PANS, PANDAS, and autoimmune encephalitis.
It's a mouthful.
Nailed that. Dr. Roseann, welcome to the Mack Talks.
Thank you. Such a pleasure to be with my friends.
How are you today?
I'm doing awesome, as always.
Awesome. So obviously, he mentioned what your background is and what you do. So what we like to do in the show is kind of take it back to the beginning and kind of get your story and how you kind of got into this industry. So take us back to, why you decided to get into the medical industry.
Sure. So, as corny as it sounds, it truly was a calling for me, and it was something that I always wanted to do. I was a young child, and I remember telling people that I wanted to be a psychiatrist, and then I learned that that meant giving medication, and I switched it to a psychologist. I was never a lover of traditional schooling and didn't really find myself as an easy learner or an excited learner, really, until I went to college. Before then, I spent a lot of time reading books. And this was the 80s, so you could sit in class and you could read books and get your work done, and people just kind of left you alone. But,
Yeah, right?
But I went to college. I really found myself and enjoying and loving what I was doing, and actually graduated a year early for my doctoral program.
Awesome.
So, but I just have always been passionate about helping people, psychology, and really holistic therapies. So my background is as the daughter of an Italian immigrant, two immigrants from Italy, and which also we'll talk a little bit about, I'm assuming, because that's what kind of got my business sense.
Yeah.
But my orientation with immigrants from Italy was just that, you looked to natural remedies for things before you went to the doctor. And so that, and food was medicine. So that really kind of colored my orientation in working. And then, I've actually already been working for 27 years in mental health. Or I should say I've had the privilege of working in 27 years.
Congratulations.
Yes.
That's awesome.
So,
a lot of people
milestone.
being helped through that process.
Yeah.
So that's great.
and I love it.
Yeah.
So you know that.
Yeah, yep.
So I started working with children and continue to primarily work with children, which I always say is people ages 28 and under. Not you, Chase. But
Yep.
so that's really what kind of led me. And then, there's just been an evolution over time.
Yeah.
And, starting out doing psychotherapy and testing and just incorporating more and more holistic, brain-based therapies, because what I was seeing, or what I have seen in this 27 years, is that people are struggling.
Yeah.
And our children in particular are there's more issues. So 54% of American children have a physical or mental health problem.
Yeah.
That's pretty scary. And what I have also seen in this 27 years is an increasing reliance on psychiatric medication without a lot of effectiveness for people. So that has really driven my work, and to try to, create this center, which I have, that's become a place that people, it's a destination, it's a place where people go to get healing, and that's pretty darn exciting. I support people locally, but more and more we're seeing people international and all over the United States, because we're doing some really cutting edge things with the incorporation of research-based therapies that support the brain and body and helping with mental health, and really finding that synergy of different therapies that help people and they can move forward.
Yeah, and that kind of leads me to, my next question. So who were some of your biggest influences with inside of this? I mean, with going in this route? I mean, it sounds to me like it was a lot of the family stuff that you had kind of, the Italian immigrant family that uses food and different things like that as the source of of medication. So who were some of your biggest influences that kind of, got you more into this field?
So that's a great question. So, because nobody's ever asked me that.
Yeah.
So you guys asked me that.
Yeah.
Certainly my family upbringing, our cultural influences, our family influences guide a lot of our decisions. And that definitely was a big part of it. I've always been holistic. I mean, I've been eating organic for 25 years.
That's great.
When it's been hard to find things. I'm personally holistic. Our whole family is. We do a lot of really, interesting, cool things. But really what really drove me from the first job I had, I worked in psychiatric hospitals for children.
Yeah.
That right there, my eyes were widened to, and what I realized was that there were a lot of really sick kids. Mm-hmm. And what was in place, even in the early 90s, was not working. So as I saw kids struggling, families struggling, especially moms, right, just filled with worry. They were trying medications, they were trying traditional talk therapy. Some people got better, but the people that I was seeing weren't, right? Mm-hmm. And I became increasingly known to work with complex cases, layered cases, which is my standard today anyway. But they drove me to say, what are we doing? How are we supporting the mental health of children? And really, I spent a lot of time, in any business, right, any practice, you need to be an expert. You need to spend a lot of time learning. Mm-hmm. And I think what happens in every field is some people learn things and they don't evolve. They don't take training. I take training really serious.
Yeah.
I train in some way every single day.
Yeah.
And
great.
It's really important to always learn, not only look at what's coming forward on cutting edge, new therapies, new things, but to look to the research. So to answer your question, really honestly, it was the ineffectiveness of the treatments that were occurring.
Yeah.
And it still drives me today because we're seeing sicker, kids with physical problems, and adults, this week I had somebody, long-term chronic depression since 2002 and never really responding to medication, chronic skin problems, chronic sleep problems, just everything you can imagine, gut issues, weight gain. And, they just weren't getting better. And, the good news is we can peel back and we can do some synergistic work in combination with diet and working with a naturopath and doing some of the brain-based therapies, to get her to where she needs to be.
Yeah, and a lot of the stuff that you do and a lot of the approach that you take, which we've spoken about before, this is not like groundbreaking that you just discovered. These are things that have been there.
Yes.
But I think part of the reason why they haven't been used as much in society is because there's more money in prescription drugs to a certain extent. And I'm not saying that, prescription drugs are completely the devil. In certain situations you have to, and I understand that, but I think we would all agree, and I think everybody would agree, that it's almost like an easy way out all the time. So it's like, write the script, and that transfers into the same thing with antibiotics and other things as well, because that's kind of almost how things were done for so many years. So if you could speak about how this type of, this type of stuff that you do, this holistic, non-medicated approach, has been something that has been done for years.
Yeah. So, you bring up such a valid point. So there's a system in place. So even driving mental health, our training is oriented that, if somebody has an issue and you've done some therapy and it's not working, right away, get them meds, right? So there's part of that. But we're increasingly accepting anxiety as a part of our life, and high levels of anxiety. And our, area of the country, and I work with people all over in other countries and other parts of America, and Canada too.
Yeah.
I have a lot of Canadians that call me.
Awesome.
And they value mental health. That, in countries with socialist medicine, they really value holistic therapies because it's cost effective.
Yeah.
In their system. But so what's happening is you have two ends driving in the middle. So you have a system set up where, okay, you're not feeling good, let me give you a script, right? And that happens in all ages. And I agree with you, there's times when medication is appropriate. But, when a 3-year-old shows signs of anxiety, we should not be giving them medication.
No, their brain is still developing, right?
Still developing, and we need to do other things. There's things that work, right? And then we have people that are like, I don't like feeling uncomfortable, right? Well, guess what? You have to work through things.
And you have to understand it.
You have to understand it and find ways to cope, right? So the therapies that I use, particularly neurofeedback is over 45 years old.
Wow.
Has tens of thousands of research studies. More than 3,000 are peer reviewed. So in mental health, medical, and when something's peer reviewed, it's a much higher standard. So these treatments are really effective. They work for a variety of things, ADHD, anxiety, depression, concussion. And the way our system is, set up in terms of big pharma, they have a lot of leverage. Every commercial now seems to be medication.
Yeah.
People get indoctrinated towards that. Some medical professionals are becoming much more open. They're inundated with complex issues now. So they're realizing it can't only be this treatment. So they are great in that they do recommend things like meditation or neurofeedback or biofeedback or counseling. So we want more of that. But that's not the standard.
Yep.
But, every single therapy we use in our office has solid research behind it. I also don't believe in just one thing. Everybody's got different issues.
And it could be a combination of things that work for you, but a combination of other things that work for Chase or whoever.
Right.
So,
and that's one of the big reasons why people come to us as a center is we really take a bio-individual approach. I wish there was a shortcut for things. I mean, I do believe in a foundation for healing that I try to tell everybody about. And that's, nutrition, that's sleep, it's stress management. It's looking at nutritional deficiencies and genetic issues. So there is a way that doesn't matter if you have anxiety, autism, or ADHD. That's the platform that has to happen in order for the body and the brain to work better. So I spent a lot of time talking about that and training other professionals and training families to support their kids. But it's important that people realize that, what you put in your mouth makes a difference, right?
Yep.
It's not the only thing. I'm not the food police, but we somehow have relegated diet as an alternative methodology. It's the silliest thing in the world.
Yeah.
So.
And you're not saying, like what I was saying before, you're not saying there shouldn't be medication.
No, I'm
at
not.
all. You're
No.
just saying that there are way more alternatives to try before taking that.
Absolutely.
And I
route.
think that's something that people don't understand, that it is kind of obvious, is that health has never been something that you can quickly, it's never been a short-term thing. It's something that you've always had to work on every single day. And people who are sick, whether you're having weight issues or whatever, the solution is never just take this pill and you're all set. It's always been kind of this thing that you have to work at every day. So then I guess my question for you is so we've been through this period of time where, you watch television and every single commercial you see is like a drug commercial. Do you think there's a return now to natural and holistic solutions? Maybe right now, in this day and age, in this era, maybe with the new generation that's coming up, do you think that we turn to to those things more? Do you think we're turning away from pharma? Like, I just want to talk a little bit about that.
So I think what has happened, I've always been this trailblazer in this field of mental health and using research-based holistic therapies. And what I used to do in the beginning was spend a lot of my time trying to educate other professionals. I'm doing that now, but people want me there.
Yeah. Yeah.
So, but now it's flipped. There's a period of awakening that's happening. And you are absolutely right. Like the millennials, they're like, hey, dude, I found this great meditation. There's just open. And so what's with the age of the internet and just information, I'm Google MD too. When I'm looking for something, I get online, and that's what people are doing. So there's online communities. There's these wonderful like ADHD Facebook groups for parents, and my Pans Pandas groups. There's wonderful groups out there. So this has changed. People are saying enough, right? I can't just hop on Prozac. I can't take Xanax every time I'm stressed out. And they're also saying, what's the root cause? Why is this happening?
That's the important thing.
That's the important thing.
Yeah.
And mental health has not really fully caught on to that yet. You have some practitioners. The clients are driving the change, and I love it. So they're the ones pushing back. They're the ones saying, no. I had a mom say, I'm going to do some really hardcore dietary changes. I'm going to get rid of sugar. I'm going to get rid of gluten and dairy, because that was appropriate for this kid. And the pediatrician said, diet has nothing to do with how the brain works. That's what the pediatrician said to her. And I was like, and I, of course, have to be nice. And I said, did you check in with yourself? Did that sound right? And she was like, heck no. And I was like, thank you. I'm glad you're here.
I think people inherently know that you can't just take a pill for something the rest of your life. If you have anxiety, if you have these issues, you can't just, what are you going to, do you really foresee yourself taking this medication for the rest of your life?
Yeah.
People are.
It's just crazy to me.
And it's not just one medication, right? Because
now they add on this one.
They add on this.
Oh, but this helps with that, and that helps with that. And then you end up in this.
It's a cocktail.
Yeah.
It's a cocktail.
It's a cocktail.
And sadly, I'm seeing, I had a kid who was underage 10 on 8 medications at underage 10.
Yeah. Oh my Lord.
Wow. How is that a life to start, right?
Yeah.
So, and every medication has a toxic load on it, and some people are more sensitive due to genetic issues with toxicity, and 50% of Americans have a specific genetic mutation, MTHFR, which has to do with both how the nervous system operates, but it also has to do with detoxing properly. So 50% of Americans have problems with detoxification. And we have such a high amount of people on these psych meds. And, if meds worked all of the time, and I don't think anything's perfect, what I do isn't perfect. That's why I offer a variety of things. So because if one thing doesn't work, then I try this. If this doesn't work. But we're over-relying, and like you said, people have to go back to the realization that it's incorporating changes into your lifestyle, right? So you do psychotherapy, which is awesome, and you feel better, but don't go back and do the same thing. You have to make changes. Yeah. So that's what we really try to support people in, is not just the healing part of things, but the psychoeducation and then sustaining change over time. And, it doesn't matter what it is, weight loss or anxiety, you have to say, well, I'm not going to think like that anymore. I've got to purposely, practice X, Y, and Z because it worked for me.
Yeah, like cholesterol, or even everything. So you had mentioned the digital era kind of helps people find these type of new things. So that's funny because it leads me into my question as far as, how much do you think the digital era, the nonstop, social media and text messages, and you're really kind of almost never alone type of thing, how much do you think that plays into, I feel like we're adjusting. I feel like it's going to take a couple of maybe generations or two to get used to, where back in the day, even us for sales, it's impossible for us to be able to reach the amount of people and to discuss the amount of things that we discuss on a daily basis 15, 20 years ago. It's just no way. You wouldn't be able to do it. So you're working your brain so much harder, and this is something that's really new to to us as, as human beings. So I'd love to hear your opinion on that.
Well, I just wrote 2 blogs on this. So
Cool.
get onto my website and read my blog.
Go digital and learn about it.
We'll plug your blogs too.
I know. So, but to tie it to your question, Scott. So there's a lot of questions people ask me, but as parents, right? But one of the hottest topics is how the heck am I managing my kids' screen time, right? Because just like you said, we're constantly getting inundated. So I think there's not an easy, it's uncharted territory. And we're going to figure it out over. But I agree with you. There's just this constant nervous system stimulation. So I'm seeing an increasing amount of everybody, all ages, with anxiety. I think there's 2 parts to the constant digital access. So one, you don't have periods of quiet mind. And you need that, right?
That's.
So I'm in there too. Everybody who knows me is like,
you have no choice.
I'm like a spaz. I'm excited about everything, and it's part of my culture.
There's so much good to it, but it's
stuff,
also it's a lot of overstimulation
that
we need to adjust to and stuff.
So like when I put my 8-year-old to bed at 8, I'm done.
Yep.
I put it in the bathroom. I typically don't check it. It's about setting a time for away from it. And I know that's not always easy, but I think it's important. And also, people now know that I don't respond to things after 8 o'clock.
Yep.
Like sometimes people are like, I can talk to you at 9:30. And I'm like, well, that's good because I'm not available. Or they'll want to talk to me at 7:30 a.m., which is much more likely. But so I think it's about setting boundaries. But this nervous system is getting overstimulated from the actual overusage, right? And the phone being next to you and you have to touch it. It's a weird feeling,
it's crazy.
Right?
Like if sometimes you just reach for your phone. Like
Right.
I get anxiety if I don't have it.
Exactly.
I straight up get
But then
anxiety.
it's funny because
and I'm not that.
There's different.
Yeah.
There's.
You're a Leo. You're chill.
But if you went, I think there's a certain amount of days, and people have done it. Like it's really tough in the beginning, but once you get past like a couple of days of getting used to it, it changes. You know what I mean? You can deal with it now.
It's setting a new pattern. It doesn't matter what it is, but I think you have to put it away.
Yeah.
Because otherwise, your brain doesn't power down, and then it's going to interfere with your sleep. And there's all this research studies that if you do it right before you go to bed, your quality of your sleep. If you're sleeping, if it's next to you, you're more likely to not go into deep sleep because your brain's going to think your phone's going off.
Yep.
And then there's also when it's near you, the EMFs are coming to you. So the EMFs alone and there's research to substantiate this. It's in my blog. But it's the EMFs alone overstimulate the nervous system. So now we have all this Wi-Fi stuff, and people are really, I'm seeing so many kids with such extreme behavioral issues and focus and a lot of anxiety, a lot of autism. People are realizing EMFs could be a part of that. And sometimes people do a whole house shut down at a certain time, like 11 p.m. to 7 a.m. and whatnot.
Yep.
These are things that are helpful for people. And I think it's something to think about. But the constant engagement on your phone and your smartphone it's something I struggle with. And I really have to learn. And I now put all my social media apps in a little folder so I can't see them. So I don't see the notifications.
It's funny. I took the Facebook thing off of my main screen because if I see it, it's just so habit. It's a habit. It's tough. Like we have to adjust because this, like you said, it's uncharted territory. Yeah. So it's like we have to adjust.
Sure.
So,
absolutely.
One of the other things I wanted you to kind of speak about, because I know that it contributes to a lot of things nowadays, is Lyme disease.
Yeah.
And I know that it's not just Lyme disease from speaking with you. I know there's lots of other things inside of, ticks and stuff like that. So if you could just speak a little bit about that and how that contributes to a lot of issues that people are having.
So, so for those of you that are listening, we're in what's called an endemic area. So there are 14 states where basically Lyme disease is at a very high rate. Lyme disease and tick-borne illness is seen on every continent except Antarctica, and it's in every country. And people don't realize that. So people will say, oh, I'm from Florida, we don't have it. That's not not true.
That's not true. Yep.
It's just that when you're in the top 14 states, not only are you likely to get bitten, you're likely to get bitten multiple times.
Yeah.
So, the thing about Lyme disease, and I'm part of 2 organizations that tie into Lyme disease. One is Lyme Connection, which is a wonderful organization, and they do so many good things. And get onto their website, they talk about prevention, and I'll talk about that. And the other is Epidemic Answers, and that's about children's health. But what we're realizing is that many people their brain and body is affected by infectious disease. And so ticks carry a lot of stuff. They carry not just Lyme. They carry
bastards.
those little, and they are so genetically evolved.
Ugh.
I mean, when you really learn about them, you are never going to walk on a lawn again. Yeah. You are never going out in the woods unless you're doing prevention before you go. So the moment a tick bites you, this is one of the most critical things that I want to implore people to know, is that the moment it bites you, it transmits the contents of its stomach. So it can pass along dozens and dozens of different types of bacteria. It can pass along parasites. And people think you has to be engorged. It does not have to be engorged. And so it's much, the research in our area that Lyme Connection was part of about 10 years ago said that between 91 and 94% of all the ticks that were caught had Lyme disease.
Wow.
That's not what we're being told. So it's pretty extreme. So why is it important to understand Lyme disease and how it affects you from, your brain and your body is people are really getting sick from Lyme disease, but they're not making the connection that their psychiatric or cognitive problems are the result. So you can get bitten. You might not be aware of it. Very few people have a rash. The estimation of a bullseye is anywhere between 12 and 31%. The research says people can have lots of rashes, including striations that look like stretch marks, which is associated with Bartonella. And I bring that up because Bartonella is very, very highly tied to psychiatric conditions. Mm-hmm. So you can get bit, and those symptoms may not show up for days, weeks, or months, or years.
Yeah.
And so
scary.
People aren't making the connection. So I've always been involved with Lyme, and anybody who knows me and knows about the book Brain Under Attack, I have a child with PANS that he got from Lyme disease. And that's, in acute psychiatric symptoms that results from a tick-borne illness. So, but people are coming to me, and what's happening is I'm either realizing it in a clinical intake, or I do QEEG brain mapping, which looks at the brain, and I can see inflammatory responses in the brain, and there's only certain conditions. So if you're struggling with mental health, I think one of the biggest messages, and also why people come to us, is a lot of people have mental health issues that result from physical problems.
Yeah.
And I think our world is not cued into that, but people are finding that information and seeking healing. And they're pushing their doctors. Unfortunately, it requires that they have to often go to specialists.
Yeah.
And so, many people with tick-borne illness, they'll have seen the average person before they get diagnosed with Lyme disease sees 5 to 7 physicians.
Wow.
The highest number of physicians or psychologists, the whole list. Somebody once came to me, I was their 55th doctor.
Wow.
Oh, Lord.
That's
But
crazy.
most of my clients will have gone, years, and they might have seen 12 to 20 people before being accurately diagnosed, which is a shame.
Yeah. Now, I've heard, and I don't know if this is true, but does it stay in your system and kind of go dormant? Or are they still trying to figure that out?
We don't know enough, but what we do know is that it can come. Lyme disease can be in 3 different forms, and it's so genetically evolved. We now trace the bacteria back to Columbus, so 1492, and that is a very, very evolved. It's 40 times more genetically complex than syphilis.
Wow.
I mean, it has this little screw-in mechanism. It gets inside the cell. It knows how to hide inside of a cell.
So you could test negative
Right.
sometimes?
So, and the testing is part of the issue. We don't have the best testing because these are genetically evolving creatures, and so we're learning. But there are some really good forms of testing through private labs, IGeneX being one of them. It's also incredibly expensive, but they just got approved by Medicaid, so they can take Medicaid. They want to take insurance. Insurance companies don't want to panel with IGeneX.
Why is that?
Because it's too much money. This is a huge medical epidemic. I think it's one of the greatest epidemics that we're ever going to know in our time. And unfortunately, we don't have highly trained physicians. There's a lot of misinformation about it. They're using incorrect diagnostic criteria. There isn't a test that diagnoses Lyme disease. It's made by a clinical intake. And so people need to be aware of that.
So what is it when they say that you go to get a test, and you comes back positive? What is
So what they're using is the criteria for Lyme study submission rates, the CDC rates. So that's not what's supposed to be. So for example, a lab in the Northeast that's frequently used is Quest. So you have to have 5 out of 10 active bands in order for most physicians to diagnose you. That is not true. That is not a clinical criteria for Lyme disease. You can have 1 active band. You could have 0 active bands, because the way that the multiple bacteria, not just Lyme, but the tick-borne illnesses, some of these bacteria are not able to show themselves in the blood for months or sometimes years, and it might come back indeterminate. When somebody has a bullseye or terrible rashes or horrible fevers, they are lucky.
Because the symptoms come out and they can. It's the little stuff that's eating you away slowly, that's doing things.
And while you're playing this guessing game, you're essentially a lost person. You're trying to figure out what's wrong with you, and you're having all these symptoms, but you don't know what's wrong, and so the real suffering is in that too. The psychological. You said you had someone
financial
visit 55 doctors.
Financial ruin. I personally know multiple people that have completely lost their homes, lost marriages. You have sick families, so you have entire families with Lyme disease. I mean, it's pretty horrible what can happen. My son does okay because we give him unbelievable care. He's got his dad too, and we very lucky, and he gets unbelievable care. I can afford all of these, different physicians, and I do all these brain-based treatments on him, and it is not an easy road, even when you have that. So late stage, there's 2 different early stage and late stage Lyme. Late stage Lyme can occur as little as 2 weeks. So when you're missing, an accurate diagnosis, and I've had people where it's obvious they have it. I recently had somebody with sudden onset OCD, which is not an uncommon thing to happen with a tick-borne illness. And he was very lucky. He had, they knew he had a parasite from the tick. He had massive fever. So they gave him 2 weeks worth of meds, which a spirochete takes 28 days to cycle. So unless you're getting 30 days of antibiotics, it's not going to kill it. So this is a major, and the research shows us that there's a great visual that I believe Dr. Ligner had, and it showed how since the 1990s, we're using less antibiotics, and the rate of Lyme disease is dramatically increased. So there's an inverse relationship happening, and we don't really know why. Some people are given 2 weeks, some people are given 2 days, some people are given 28 days. It's sort of like, but you need to have 30 days. I'm not saying antibiotics is the only thing, but if you have acute onset, don't mess around. Get some antibiotics. And this poor person found me because my lovely Mack Media digital marketing, and came in, and he said to me, it is a God honest truth. He said, "You saved my life," and I was like, "I absolutely saved your life. You'd be in a psych hospital right now."
That's crazy.
And I was able to pull some strings, got him into somebody really fast. He needed antibiotics, and then we helped him. We helped him with our brain-based therapies, which really helped him, and he was so lucky. And it's sad because if he was given the right amount of antibiotics, he may not have come to me. I still think he would have been there because what we discovered is really he's had the striations for years, more than 10 years.
Wow.
That would indicate Bartonella. So anyway, thank you I'm very passionate about Lyme disease,
Yeah, I know,
and I
that's why I
wish
wanted to
more
bring it up.
people.
You're like an encyclopedia for Lyme disease.
Now,
Yeah, I am.
I know you're not a veterinarian.
Yeah.
but I have this question for you.
Sure, go ahead.
How the hell can a dog get a Lyme vaccine?
So guess what?
What?
Because veterinarians acknowledge that Lyme disease is real.
Yeah.
They have much better diagnostics and
Wow.
treatments. So most of you dog owners, their dogs get tested every 6 months, right?
Yeah.
So that's what's going on there.
Okay.
Yeah,
All right. I
they're
was
just
always curious
getting
about
much
that.
better care.
Yeah. Wow. I was always
So
curious about that.
like I said, we don't have perfect testing, but we have some pretty good testing, and it's not. It's a big deal that IGeneX now is being accepted Medicaid. So we're hoping that's going to allow people because it's expensive testing.
Yeah.
But
Yep.
it's needed. And some people, it's pretty obvious. And you just start treating. Like the man that I was talking about, he just went and got treated. And they
Yeah.
didn't even wait for the blood results. But
Yep.
it was substantiated.
Yeah.
And by the way, every single bacteria that I said you have based on your clinical symptoms, bam, bam, boom, he tested positive for.
Wow.
So, because this is how it's a sad thing. I know I'm super knowledgeable about infectious disease, but medical doctors are very intelligent people.
Yeah.
They can learn this too.
Yeah, exactly. Yep.
So
They have that hubris, though. I think a lot of them have the, you know what I mean? They
Yeah.
just have that. They think they know everything, and so they always turn to traditional medicine, and they just are stubborn that way. I think.
Yeah,
Well-
we Chase, you better hope that your
Yeah.
physician does not hear this
Yes.
podcast, buddy, because if he does, you're.
I think what happens is they're inundated with a lot of things. And I think particularly with Lyme, I was already involved before I had my own child because I had clients that I was like, there's something physically wrong with them. So that's how I got involved. But unless there's a personal connection, I feel like they don't have that knowledge. But also too, I've had a lot of patients I had a pediatrician who was like, very adamantly against neurofeedback. I mean, to the point where she was like, don't do it. Oh,
wow.
And she called me one day and asked me to come to her office. And I was like, okay. And I went there. And she said, I have had so many of your clients just have unbelievable results, and a few kids who were on the autistic spectrum who no longer met the clinical criteria, that I had to change my mind about neurofeedback.
Wow.
And she's one of my best referrers.
That's cool.
wow.
So people have to be open.
Yeah, that's the biggest thing. To just be like, no, this is what I taught. And the thing that a lot of times doctors do too, and I get it because, they're trying to take as many appointments as they can. It's like they just put you in a box. It's like, you have this symptom. Okay, here's this med. Like,
Yeah.
you know what I mean? And that has to change. That's why people have to advocate for themselves. Like, don't just, and that's what people are doing nowadays with the internet.
Definitely.
They're not just accepting, this doctor told me this, so that's it. Oh, what's wrong? You tell your friend, they're like, oh, maybe you should go see somebody else. Like, and nowadays that's what people do. And I think that's super important. So
super important. I tell all the individuals that come to me, particularly parents, like, look at what I'm telling you as advice, but you have to check in with yourself and feel like if that feels like that's authentic or that's the right
like
thing.
what you said to the
Absolutely.
does that make sense?
Does that make sense? Does this feel like it's right? And you have to have whatever you're doing, you have to have trust in that provider and hope that those things work. And even with Lyme disease, we don't know what exact treatment is working.
Yeah.
One person, we're learning more and more and more because it's an epidemic. I mean, there's just so many people afflicted.
So we have to get ready to wrap
Yeah.
up. So real quick, just give a couple tips to people that are struggling with, depression, anxiety, parents who have children that are struggling, that are going through a hard time. I know you mentioned diet. So just give people just a couple of tips as far as, what you would suggest.
Yeah. So, for parents where a kid is struggling emotionally or behaviorally, I think the first thing to do is to look at their diet and say, what can I do? How can I get my child to get more nutrients out of food? Because I think people have a misconception that, we're saying wheat is bad or dairy is bad. It's about getting nutrients to the brain and the body. So, what I always tell everybody is try an anti-inflammatory diet. You don't have to be perfect. Start with little things. Don't, especially for parents that have infants or thinking about having kids, don't eat off the kids menu.
Yeah.
That is full of garbage. So start with that. Start with mindfulness at home and try to do activities at home that bring calming and teach kids how to manage stress. I think that we're role models for managing stress. And don't get me wrong, I'm a mom just like everybody else. And I've had a meltdown in the middle of BJ's and, all that other stuff. I'm the mother of a teenager. We've all been there. And, but you really have to, I tell my kids, listen, I'm stressed out and this is why, and this is what I'm going to do right now. Let's go and run outside. Let's go and do this. So they can see that, guess what? Mom and dad are human beings and we all have stress and we learn how to manage it. So the diet, good sleep. And, if you're struggling and, in terms of parenting, there's no right or wrong way, but you really want to try to be as positive as possible, set clear, boundaries with your kids, but be flexible and have loving limits. And when you're struggling in any component of parent, seek professional help.
Yeah.
They are people that give you shortcuts.
Yep.
And help you.
That have used it before. And
Yeah.
that's the other good thing about social media is that you can connect with so many other people and
Absolutely.
hear other people's stories. And that
Yeah.
gives you faith in being able to
Absolutely.
get through those tough times and
stuff. I also want to say that, I have 2 special needs kids. My little sweetie pie has dyslexia. And when you know something is going on, there's like a little bell going off or you see some red flags, do something about it.
Yeah.
I have people every day that are like, my kid had anxiety for their entire lives. And you're the first person that we've seen.
Yeah.
Give them the gift of learning how to manage that so that you don't have these major things. And ask your friends. I'm not saying pediatricians are great people to ask, but again, if we're trying to avoid the medication piece, not every person is on board with other things, but start with a therapist. Ask your friends, ask other people, and, go from there. But I think people ignore the earlier you address things, the better. That's my best advice.
Awesome. Thank you so much. So now is the part of our show that we have a segment that's called One Question from Kev the Intern.
Uh-oh.
That's
okay.
him right there. Come on over, Kev. This mic right here, buddy.
Okay,
yeah, go
cool.
ahead, buddy.
Hi, so...
A little closer.
Okay, hi.
Hello.
As somebody who, has gone through, ADHD and anxiety, has been taking medication for, 16 years, therapy for that long, and I can ask you a million questions. But the one thing I wanted to ask you, what would you say to somebody who has been taking this medication for so long and is wondering if it's even worth it at this point? Because I've been taking medication so many times, and sometimes it can feel tedious at some point because I take it every morning.
You're not sure it's helping.
That's where it's hard.
Yeah. So the research, the clinical research, it's replicated research numerous times, shows us that with ADD meds after 3 years, they're no longer effective. That a non-medicated and a medicated kid with ADHD look exactly the same. Okay, so it's probably not working. But, what I would say to you is there's really amazing natural alternatives. So if you want to get online, I have a good blog about alternatives. And so there's a couple things. So I really believe in naturopathic care. So those are physicians that are trained with natural medicines. Not every state has naturopaths, but some states have acupuncturists that can do it, or chiropractors. Connecticut does have naturopathic care. And I would start there and I would have them look at what are your nutrient deficiencies, because I'm looking at Kev and I'm telling you right now that you're vitamin D deficient. I can see it. So
And we all are in New England to a certain extent.
You are.
Yeah,
70% of
in New
people
England,
are. So it's pretty
Yeah.
obvious.
Yep.
So, but I also know what happens to the brain and body with long-term psychostimulant use. And so it starts robbing you of nutrients because it has to do with your appetite and what you're eating and whatnot. whatnot. So I would start there, look at that, and then there are really fantastic supplements that work on the same way that Psychopharm does without the side effects, right? So that's a good place. Or, call me, come in, we'll do a brain map and we'll do some neurofeedback. So and neurofeedback is direct brainwave retraining. ADD is ridiculously, I want to say it's easy, but I'm going to be appropriate and say that the research substantiates, it's so, it's easily remedied. It's very effective treatment for ADHD. But so you have two good alternatives, and you can also do them at the same time. But I would look, if you feel like it's probably not working, it probably isn't.
Yeah.
And you're probably, I'm sure, because you probably have a genetic mutation, you're probably vitamin B deficient. So, and that has to be a special form. So start with a naturopath. I'll give you a name.
Yeah, awesome. And I just want to, for a quick second, I just want to give big ups to Kev for that question and for
Sharon.
Just being honest and exposing that kind of personal thing, because I think that type of stuff and the stigmatism of behind mental health is going away. You're seeing athletes come out now. Absolutely. You're seeing, Kev he felt comfortable enough to just say that on our podcast, and the same thing that he struggled with are things that I've struggled with, growing up and even as an adult, and same thing with my son, and I'm going through those different things now. So I just want to give big ups to Kev. That was an awesome question, and I think it was really cool that he kind of put himself out there, and I think that's great, and I think that we need to do more of that. So
thank you for saying that.
Yeah, yep.
We need to destigmatize, because it's really about brain health.
Yep.
Right. And it's not. There's no negative connotation. It's like, and there's so many wonderful things that your brain can start regulating.
It's really no different than a broken foot.
I mean, really,
you shouldn't be ashamed to have a broken foot. You shouldn't be ashamed to be dealing with anxiety, depression, ADHD,
everything.
or any of these things.
And that's why I say, don't wait.
Yeah.
It's when people come to me in crisis every single day, and I'm happy to help them, and I can do a lot of wonderful things.
Preventative.
It's preventative.
Yep.
Preventative. And the younger, the younger the kid is, the better. People take a wait and fail approach with everything, and it's not necessary.
Yeah.
And it also supports parents too. They need help.
Yeah.
We need a community.
Yeah.
And so
Awesome.
yes. So thanks, Kev.
Thank you for coming on the show.
Oh, my pleasure.
We really appreciate it. Young Chaseford is going to close us out here. He's going to give us your handles and everything of where all of your information and stuff. So.
Yep. So first of all, thanks for joining us, everybody. And if you're looking to learn more about Dr. Roseann and the wonderful services she provides, you can find more information on our website, drroseann.com. That's www.drroseann.com, or her Instagram, which is at Dr. Roseann and Associates. That's at DRROSEANNANDASSOC. And finally, her new book, which she co-authored, is called Brain Under Attack. You can find that on Amazon. Dr. Roseann, thank you for coming by. And for all of our listeners, if you like our content, please feel free to leave us a review on iTunes, subscribe to our YouTube channel, and like us on Facebook. Also follow us on Instagram. That's at Mack Talks, MACK Talks. And that's it.
Awesome.
Thank you so much.
Be
All
well.
right, cool. Thanks. Next time.